Hey everyone, today we are going to break down cirrhosis. So what is cirrhosis? Cirrhosis is the permanent scarring of the liver. So the healthy liver are usually smooth and functional, whereas the cirrhotic liver is scarred, lumpy, and failing. Here's what happens. Your liver gets damaged repeatedly over 10 to 20 years, so over time it tries to heal and it forms the scar tissue instead of healthy tissues. So eventually so much scar tissue builds up that the liver can't function anymore. So the scary part is that this is irreversible. So once the scar tissue forms, it's permanent. So that's why prevention is everything. Let's move into the causes. We have three causes, main causes: alcohol, fatty liver, and hepatitis C. Symptoms are usually ascites, fluid buildup in the abdomen, and jaundice, yellowing of the skin and eye, and as well as the spider angioma, where the tiny spider-shaped blood vessels appear on the chest and face. Red palms, the palms turn red, especially at the base. Gynecomastia in men, breast tissue develops because the liver can't break down estrogen properly. So the dangerous complications are hepatic encephalopathy and hepatorenal syndrome and bleeding problems. So the bottom line is that cirrhosis doesn't just affect the liver, it affects the entire body. Let's move into the diagnosis. We usually diagnose through blood tests, ultrasound, and liver biopsy. So blood test, we see high liver enzymes, ALT, AST means liver cells are dying, and high bilirubin causes the yellow color, and low bilirubin, so liver it's not making enough protein. Prolonged clotting time, liver isn't making clotting factors. So the ultrasound shows a shrunken, bumpy, scarred liver instead of smooth and uniform. FibroScan measures liver stiffness. Scar tissue is stiff, healthy tissues are soft. So liver biopsy is the standard, gold standard. They take a tiny tissue sample with a needle, but they only do this if other tests are unclear. So because it is invasive, it's not done quite often. Most of the time, blood test plus the ultrasound imaging are enough. So in treatment, the truth is that you can't reverse cirrhosis, but you can stop it from getting worse and managing the complications. To stop the damage, should stop alcohol, and by completely, like forever stopping it, and fatty liver by reducing weight and doing exercises, eating healthier, controlling diabetes. For hepatitis B and C, taking antiviral medications. For hepatitis C, taking sofosbuvir, and for B, tenofovir. So managing the complications: for ascites, taking spironolactone and paracentesis. For encephalopathy, lactulose and rifaximin. For bleeding risk, beta blockers. And for nutrition, taking adequate proteins and calories, and also taking vitamin supplements. So in severe cases, the only option is liver transplant. So let's move into prognosis and prevention. There are two stages of cirrhosis: compensated and uncompensated. Compensated is the liver is scarred but is still working. Few symptoms. It can live 10 to more than 15 years. The goal is to stop progression. Whereas in decompensation, liver is failing. Complications develop. Average survival is 2 to 3 years without transplant. So the key is to catch it early and to stop damage before it decompensates. So So the prevention is simple: to limit and avoid alcohol and maintain healthy weights and get vaccinated for hepatitis A and B. Practicing safe sex, not sharing needles, and getting screened if there is any risk. So the liver can regenerate from a lot of damage, but once cirrhosis sets in, there is no going back. So protecting is necessary. So that's it for today. So if you find this useful, please hit the like button and subscribe and share it with your friends. Thank you.